This is Khayelitsha in the Western Cape of South Africa. Almost 1 million people live in this sprawling township. In these conditions, the health of pregnant women and children is often overlooked. Philani, an organization started in 1979 by Dr. Ingrid Leroux, is committed to addressing their needs.
South Africa is doing very poorly with the Millennium Development Goals 4 and 5. And this is an attempt to try to develop a model which will address our poor performance in those two areas, maternal and child health.
Maternal and child health is a serious concern in South Africa. 1 in every 5 babies die in the country before they even reach their 5th birthday. Almost 30% of pregnant mothers are HIV positive, and we have one of the lowest rates of exclusive breastfeeding in the world.
Every child in this country needs to be allowed to develop its full potential. And you have to start with nutrition and health, and education will come. But a child that is malnourished and sick is not going to be educated. So we felt nutrition is the basis.
Philani's flagship program is their home-based outreach program, where community health workers, or mentor mothers, go from house to house identifying pregnant women and malnourished children. With 120 mentor mothers working with over 4,000 families in Cape Town every year, the program has now expanded to include the very rural Zitulele and Coffee Bay area in the Eastern Cape. When this mother gave birth to premature twins, she didn't know how to care for them or about the benefits of breastfeeding. They were severely underweight when a Philani mentor mother found them while doing her home visits. Malnourishment is one of the main causes of mental and physical disability amongst children in South Africa. Mentor mothers educate pregnant women on the benefits of exclusive breastfeeding, weigh children regularly to monitor their growth, and teach mothers how to make healthy meals that they can afford. In rural areas like this, vast distances sometimes makes getting to clinics or hospitals impossible. More mentor mothers are needed in rural areas to help patients get the care they need. This young mother was too sick and lived too far from the hospital to get treatment for her and her child.
Wandinceda ukuba mandiye esibhedlele and futhi kukubi kwakum ndigula kwamna wandisa esibhedlele ndithatha ngokwakhe wandisa ezithulele ndalifumana uncedo ezithulele esibhedlele waphinda futhi unontlalo xa ndisatshwa esibhedlele wandithatha ngokwakhe wandibuyisela ekhaya ungafuthi ndingakhwelanga mali yam.
Prevention is the main focus of the national effort to revitalize primary health care. Across the country, primary healthcare outreach teams are being rolled out. Mentor mothers address problems before they occur by starting to help women when they are pregnant. They ensure they register at an antenatal clinic, go for regular checkups, test for HIV and learn about breastfeeding, and continue to support mothers after their child is born.
So for me, it has been successful because each and every year we carry a caseload of about 4,000 families. And in most of the time, those families, we discharge them with good outcomes. Children become rehabilitated and they go back to school. And mothers give birth to healthy children and they continue to sustain that.
A mentor mother first visited Thandeka when she was pregnant and encouraged her to get an HIV test. She was distraught when she found out she was HIV positive. Her mentor mother supported her through her pregnancy, and thanks to successful prevention of mother-to-child HIV transmission treatment, Thandeka gave birth to a healthy HIV-negative baby boy. Her relationship with her mentor mother is a special one.
She's my everything. Mom, sister, I think she like, I feel like I could cry on her shoulder. Like every time when I have problem, I go to her and we talk. Like she's always been there for me.
One of the reasons for the success of the program is the way mentor mothers are selected from the community.
We looked at all the models that have worked in the world, and we came across a model that is called positive deviant model, where women who have managed to raise healthy children despite poverty are the ones who are taken to go back into their communities to share their coping skills. We are using that model into the Philani outreach model.
Doctors and nurses in clinics aren't always able to understand a patient's situation at home or the language they speak, but these mentor mothers are all from the areas where their patients live and have themselves raised healthy children under the same conditions.
So you empower somebody who is in this community, who understands all the dynamics of this community and who is able to relate and who has experienced this herself. And then that person then comes back with knowledge and shares her knowledge and also her own coping skills.
A scientific study comparing households that have received help from Philani health workers and those who haven't found that this home-based care model has been incredibly successful in improving the health of the mothers and children they attend to. This was shown by increased rates of breastfeeding, adherence to treatment, and improved infant development.
If we don't look after our children, then then any country's in deep trouble. So maternal and child health is a global priority. This first 1,000 days in development, the first 2 years and the period of gestation is central in terms of brain development, in terms of correct adequate nutrition. If you get the first 1,000 days right, your impact over the life course is much easier. You get it wrong then, and you're playing catch up.
Mentor mothers are able to assess the family situation as a whole, and the entire household receives care as a result.
There's an English saying that says charity begins at home, and even health begins at home. If you have not been able to target health from home, you failed that whole home. When we visit families, our main entry is a child, a malnourished child. But when we get into the home, there will be more health challenges in that home.
The early years of childhood are essential in the development of a child. Mentor mothers teach parents how to use inexpensive household items to stimulate their children and help them learn important skills during these crucial formative years.
The good thing about it is that it's a self-rewarding, and the successes of it, some of them you may not be able to measure. Because if you can tell me, how do you measure hope? Because what they do every day is to inspire women in the community, is to get people to think back and to be able to have hope that things will change.
Philani's work has made a huge difference in the lives of thousands in these impoverished communities by helping mothers raise healthy families.
It was so lovely to have her, because I am this mother now who has this lovely boy, and he's healthy because of her.
By giving mothers vital education and support, they are helping to ensure a healthier generation of children.
Ndiziva ndiright ebomini bam xa uPhilani khona. Ndiyavuya ebomini bam. Ndiziva ndiright, ndingumama oright ngoku. Ndinje. Yabo.